Hello, and to those who've been following, welcome here. Those who are new, this is Medic Academy, where we discuss knowledge areas around nursing, medicine, literally all aspects of health. But this series, I have say that we're going to focus on the nursing care plans because this is an area that the nursing fraternity, most of the time people have this myth that is kind of difficult. So welcome again for those who've been with me, and those who are new, feel free to watch the previous video where we started on what is a nursing care plan, objectives of conduct of generating a nursing care plan, and the significance, or rather the importance of having a nursing care plan. So as we proceed, I want to look at the types of nursing care plans. You need to know that as you also generate the nursing care plans, they have different types. So it's mostly when you go to the department where you work, you will find just a standard care plan that you find there and you fill, and that's it. But the nursing care plans are actually of different types. So I want to discuss those, and then from there we'll keep on progressing from here. So the nursing care plans are divided into two, and we have the informal nursing care plans and the formal nursing care plans. So the informal nursing plans, just the way the word says it, it's informal. So it's just a strategy of actions that exist in the nurse's mind, and the actions wishes, and these are the actions the nurse wishes to accomplish during their shift. It's an unwritten, in short, it's an unwritten plan. So it's not put on paper, it's not really put in an organized way. It's just an informal order of what the nurse has planned to do her shifts or to execute her goals and expected outcomes in that particular shift or a particular time, but it's not put down on paper. And you realize most of us, I think, practice this informal nursing care planning than the formal one, where like you go to the ward, you get the report, and when you're done, you have everything scribbled down on a piece of paper, and that's what you're using the whole day. But rather, the opposite of it is what we call the formal nursing care plan. So the formal nursing care plan is a written and a computerized guide. So it can either be a written or a computerized guide that organizes the client care information and the plan itself. So with the formal nursing care plan, this is where we are going to focus our main series on, and we'll be looking at how these formal nursing care plans are written, and you'll be amazed to see that actually even the formal care plans also don't look the same everywhere. There are even different types of formal nursing care plans. However, just to remind you, the formal nursing care plan, it's a written document or it's a computerized guide or guided document that helps the nurses to organize and put the client care and information in a way that even the next nurse can pick and get guided on the next shift. So those are the two types of care plans, informal and formal. Informal, it's unwritten, it's in the nurse's mind, and this is what will guide what the nurse wishes to accomplish. The formal nursing care plan, written or computerized guide that is helping the nurse to organize the patient care, goals, and even the plan for the shift. For example, in certain wards in the standardized care plan, you realize that at a certain time like 9 a.m., you keep administering medication for all the patient in that ward. You do not like give for one patient and then say I'll come back and give it to another patient. It's cuts for all the patient. So that's an example of standardized. However, on the individualized care plans, you do a care plan, but it's tailored to just meet the specific client unique needs and does not address all the patients. So I find that you have a care plan, maybe it's using the same format for all the patients, but in this one you have tailored it in such a way that you're meeting one specific patient at a time, or you're taking care of one specific patient at a time. All right, so luckily I have exhausted on these standardized care plans, and this, like we've said, it's a guided document, but it ensures that the patients are all receiving a consistent standard level of care. However, these care plans are used to ensure that minimally accepted criteria are met. Like this is the basics: medication, may say with dressings, Cleanliness and hygiene, those are basic care plans that can be administered at similar time or at the same time. However, they are good care plans because they promote efficient use of the nurse's time. Your work is organized, your time is well outlined, because if, for example, in the nursing care plan standards is at maybe 7 a.m., people are receiving report. At 9 a.m., there's administration of medication. At, let's say, 10:30, there's nutrition needs. Maybe 12, you're preparing to hand over. That is a standard, and it will be taking place like that across all the patient's cares. But now it also helps as a starting point for a nurse to start developing an individual care plan. Because if your timeline is outlined clearly, then you all understand the basics of how the particular department operates. But again, as you get your standard care in place, you're able to pick what is different in each patient. So for example, you may understand that each patient receives medication at 9 a.m., but you'll also realize some patient may have extra medication that they need to receive at a time that is not 9 a.m. So from there, you start generating the individualized care plans, or rather care plans that do not fall within the standards. And that's what brings us to the individualized care plans. So this is let me put in the basics of words, like this is customized, or rather it's a customized care plan that is going to meet specific needs and goals of the individual clients. So it allows more personalized and holistic care, which is better suited for the client's unique needs, strengths, and goals. And the agenda here is to ensure there is holistic and specific care for that patient. Somewhat you go and patients have same conditions. Lucky you, because that will make your work so easy. You can just get a standardized care plan for all of them. But in some departments you go and patients are demonstrating different level of severity to conditions. And due to that, we may be forced to do an individualized care plan. In this case, you need to get customized, be personalized, personalize the care for each patient and generate a specific care plan for each. So in this case, the importance of it is that there's improvement of the patient satisfaction, but again, there is proper care that is given because you are meeting the unique needs of this particular patient without putting them in a common group. So these are just a few tips I thought I could bring them up on how to individualize the nursing care plan. So if you want to get a nice and well outlined individualized nursing care plan, then you need some tips on how to handle it. So number one, you need to know how to perform a comprehensive nursing assessment of your patient care, like an history and status and desired goal. So I want to also understand that when people maybe arrive in their shifts, there's always the moment of receiving and giving reports. And this is at the moment where you can easily perform an assessment on the patients. Yeah, normally it's very brief, but you can actually get to see the current status of the patient, who is the most sick, who is a highly likelihood to be discharged. So you can pick all those assessments of your patients, and this can guide you in generating the individualized nursing care plan. The other part is learn to involve your patient in the nursing care planning. Like ask them, what are their health goals? What are their preferences? How are they faring as per the care that they're receiving at that particular time? This will help you pick new arising needs that the patient could not have communicated in the previous report, or shift. And so you as the nurse taking over now is able to come up with a way detailed individualized care plan. And thirdly, always perform an ongoing assessment. Learn to always follow up and catch up on your patient ongoing progress on their health status. Walk around, assess, get to hear their reports, get to hear their verbalization, get to see the symptoms progress and all that. And this, you can pick any form of changes in their health status or any state that needs you to document accordingly. So the individualized care plan is good, but you need to also learn to adjust that care plan accordingly. Like as you keep doing the ongoing assessment, pick areas that will require you to adjust and make sure you adjust them on time. So there are tips that are nice for you to know, like know how to perform a good assessment of patients, involve your patient in your care, perform ongoing assessments and evaluation, and learn to adjust the care accordingly, because it will not look the same every day, or even during the shifts some changes may happen in your patients and you'll have to adjust that into the individualized care plan. So yeah, those are what I wanted us to speak on as we on this chapter of types of nursing care plan. So I've mentioned uh, standardized, and first we started with the formal and the informal, and then we headed to the formal category where we have standardized care plan and individuals care plan. So if you're still enjoying this series, keep it all here. Kindly like this page. You can also comment and ask questions around it, but don't forget to subscribe. Click that subscribe button. Share these videos also, guys, and keep enjoying this. Thank you, and bye bye.